Dr. Kristie Ennis. Today I am going to show you how to stretch this back muscle that tends to get tight in us, and actually how not to stretch it too, because I often see people do the wrong thing to try to make this feel better. So what is this muscle I keep talking about? It is called your quadratus lumborum, or QL for short, which is much easier than saying quadratus lumborum all day long. So this muscle does a lot though. It attaches to the top of the hip, it attaches to the 12th rib, and it attaches to some of these vertebrae. So it helps to hike the hip, and also in that rib cage, right? And then that rotation. So it really does a lot of different things. So it can cause a big problem. And as you can see, it is literally right in the low back. So when most people say, I have low back pain, very often they're talking about this muscle. Now that muscle tends to get tight for a few different reasons. Number one, if you tend to be somebody who sits in your chair or on the ground and you shift, you hike that hip, automatically you're going to tighten up that muscle. Sometimes sleeping on your side too, and kind of sleeping with one leg up, will shift that muscle as well. And then if you actually have some tightness in your hip or in some part of the side of the hip, or even a little weakness there, then that happy little muscle there tends to take over and tighten up too. So there's a lot of different reasons that that muscle can get tight, and it's why I see that muscle being an issue for a lot of people. All right, so what do we do for it? Number one, we want to start just like with any other muscle on the release first, and then move into the stretch. So we're going to take this fabulous tennis ball, and I recommend using a nice gently used one if you can, so that it's a little bit softer. But you're going to lie on your side, excuse me, right where that muscle is. So ball's going to come down in between that rib cage and that hip. And you may already be going, whoo, a little sore, and that's okay. But then you're going to take this bottom leg, and so now I'm kind of hiking my hip up, right? And then straightening it back out. You can even add a little elbow to knee. It looks really funny, especially if you have no idea why someone is doing this, but it works really well. You're going to do it until it doesn't feel quite as bad. If it feels like it's giving a little bit softer. And then from there, you're going to go ahead and stretch it. And there are two different stretches that I like to use, and you can choose which one feels better for you. So if we're working on stretching this right side, if you go into what's typically a child's pose stretch with a little bit of a variation. So butt down towards your heels, and then to stretch this side, you're going to drop the butt off the right side of your heels. So now we're depressing, right? Getting that hip down, and then bringing those hands to the other side, right hand on top of that left one. So you're getting a little rotation, a little bit of elevation through that rib cage, and then bringing that hip down. And then you're going to end up stretching this a little bit. If you just bring those arms over, you're missing the hip connection. So you tend to stretch more into the lats than you do into that low back part. So do make sure that you really try to drop that butt off the edge. And then the other way to do it, you can do this even at the office, especially if you don't want to get down onto the ground when you're working. But if you have your typical office chair and you drop one side off, so there we go, bringing that hip down. You're bringing that hip back a little bit, arm overhead, and you can add a nice little reach, and again, add a little rotation if that feels good. Again, looks kind of funny, but it really does a nice job of stretching this muscle out. So again, release first, then the stretch. Now, what don't you want to do? And I see this a lot, is that people grab their foam roller, which is not necessarily bad to have a foam roller, but I'll see this. People will lie right on top of that and try to get right into that lumbar spine. Notice I can't breathe as I'm doing this? That's bad. Number one, usually you're just smushing and compressing into the rib cage, okay, which is not what we want to do. That's why a smaller object works a little bit better. And then if you're just lying over it on your back, notice how much I'm arching into that spine, which is actually really bad for the spine. So you end up not targeting it the way you need to, and actually increasing some concern and issue into the spine itself. And even if you try to do it sideways like I showed you, again, you're kind of jamming it right into that rib cage and pushing those ribs up which isn't really going to help you at all, okay? So gentle release first, one of those two stretches, and then no foam roller. Just get that out of your vocabulary for right now. So other than that, pretty easy, pretty simple, hopefully pretty comfortable too. And you should be able to do this a couple times a day to get that nice and soft and loose. So thank you for tuning in today. For more information, check out my website at drkristieennis.com and stay tuned on YouTube for more. Thanks.